My name is Ranj Rajendram. I'm a medical retina consultant at Moorfields Eye Hospital, and we're going to talk about retinal vein occlusions or blockages in retinal veins. This is a very common cause of visual loss and it's quite difficult to treat. So we want to look at the risk factors for that and whether there's anything we can do to predict these events to try and prevent them happening. We want to do this with a mathematical modelling approach with the engineers here at UCL looking at computational fluid dynamics. The eye is basically a camera, and so you have the retina at the back, which is like the film or sensor in the camera, and this uses more oxygen than any other tissue of your body, and so it's very dependent on its blood supply. Any blockage or retinal vein occlusion can impact the blood supply and then the vision very quickly. We want to look at retinal blood vessels and what may be risk factors for blocking of these retinal blood vessels. These may include things such as high blood pressure, high cholesterol, thickening of the blood, or an angulation of the retinal wall due to pressing of the artery on the wall. We want to model these dynamics and see if these risk factors can be modified, what would happen in a controlled situation. Now I'll hand over to Vanessa to talk about the computational fluid dynamics modelling of retinal vein occlusions.
My name is Vanessa Diaz and I'm a reader in bioengineering in the Department of Mechanical Engineering at UCL. So we've been discussing with Ranj how to provide engineering solutions to this, to understanding the venous flow in the eye and how to help these patients keep their vision for longer. And we think that we can use some state-of-the-art computational fluid dynamics to do patient-specific modeling. So we look at the patient's vasculature and we compute things such as pressures and flows to try to understand where the problematic regions are, regions of low pressure or where there is no flow, and maybe help them understand better how to address these issues through therapy. But also we can look at the nature of blood cells and the nature of the blood flow in these absolutely minuscule channels. And we can look at how red blood cells aggregate and if there are particular therapies that can be given to these patients to try to improve their vision or to try to keep it, as I said, for longer. So we've been discussing with the clinician about the things that we could potentially do, for example, by controlling the blood pressure or by coming up with some type of solutions to improve the blood flow in certain areas. And I think that's what this aggregated platform of doing the experiments and the computations can bring. And we think that we can bring it to life really well, actually. So we're really excited about this project, and we're hoping a really enthusiastic student might be able to take it on. We think that we got a great team. Moorfields is a leading hospital, worldwide recognized mechanical engineering in UCL. We have a fantastic fluidics platform that deals with microfluidics, but also macroscopic flows. And we have a lot of expertise on multi-scale modeling, which is actually what this project requires, because the complex nature of this flow and the very multiple scales that you're looking at requires combined expertise and a really nice team that we are.